Let's talk intra-abdominal pressure, because this is something that I have referred to time and time again in so many of my videos, and I actually think it deserves a little more explanation. So intra-abdominal pressure is defined as the steady state pressure that is concealed within our abdominal cavity that is formed by the interaction between our organs and our abdominal walls. Essentially, what this means is when all the muscles making up your core canister, your diaphragm, your pelvic floor, transverse abdominis and multifidus, are contracting together along with the abdominal muscles in a balanced way, this actually generates a pressure within the abdominal cavity. And this pressure provides support to your spine, so it's very important. And it's important to remember also that there's not an air component to this intra-abdominal pressure. So then how do our internal organs come into play in all of this? And wait for this, because it's actually totally insane. And this is where the diaphragm really comes into it. So as the diaphragm contracts, it flattens and descends. And this action of the diaphragm pushes the internal organs in the abdominal cavity downward, and the linings of our organs are full of water. This water then creates a force that pushes against the diaphragm, pelvic floor and abdominal walls, and it's this force that's referred to as intra-abdominal pressure. And when it comes to pregnancy, maintaining neutral intra-abdominal pressure and core stability, what's really important is the interactive nature of the abdominal wall, the pelvic floor, and the connective tissues that counter this intra-abdominal pressure. And it's when this interactive balance gets kind of distorted some way, by maybe incorrect breathing technique or overactive muscles, like constantly holding onto your abdominals or gripping through your obliques or not relaxing your pelvic floor. And all of these are really, really common holding patterns. But the important thing to remember is when one component of this is not working, it creates pressure in other areas. And a good way to think of this is to think of a squishy stress ball here, right? So the squishy stress ball is your core. At the top is your diaphragm, bottom is your pelvic floor, at the front are your abdominals, right? And if you squish the center, this would then cause you to blow out through the top and the bottom of your core canister. This would affect the ability for your diaphragm to contract and relax, which, as you know, the diaphragm is integral in intra-abdominal pressure. It would also put pressure on your pelvic floor, which is not ideal in pregnancy, as this area is already softening and relaxing to allow for the birth of your baby. And if you're overactive through your upper abdominals, the ball would bulge through the lower belly and pelvic floor. Again, not ideal during pregnancy, as both linea alba and pelvic ligaments are softening. Same as being overactive through your obliques, which is super common. But in terms of kind of the stress ball here, think about squeezing both the sides. The ball then bulges through the belly at the front and downwards through the pelvic floor. And the key with intra-abdominal pressure, abdominal separation and pelvic floor dysfunction is that we want to be breathing through movement while maintaining neutral intra-abdominal pressure, using the three parts of your core canister, being the diaphragm, your pelvic floor, and transverse abdominis. And this is done by mastering your TVA breathing. Of course, all pregnancy process clients have specific exercises which also help them with this. Now, the opposite of this would be things like bracing, breath holding, or bearing down. And for those who aren't sure what bearing down is, it's what you might do to, say, push out a poop, right? Which I don't recommend doing, by the way. But you might also associate that bearing down with pushing out your baby. But again, that's not correct and not what you want to be doing. And again, I talk about all of this in much greater detail in the pregnancy process program, so I'm not going to be going into it here in this video. But when it comes to training during pregnancy, there are also certain exercises and things that I personally tend to avoid or alter due to the known increase in intra-abdominal pressure and load that it places on the abdominals. Basically, when it comes to program design, pelvic floor, abdominal separation, and intra-abdominal pressure, I'm fairly conservative and tend to err on the side of caution and have the approach of potential cost versus short-term benefit. And it's really important during pregnancy that you're actually proactive in establishing good breathing and muscle activation patterns as opposed to being reactive postnatally. Because by being proactive in this department, you're already helping yourself in your postnatal recovery journey. Now, if you want a gold standard path where you're fully engaged in all aspects of health and well-being during pregnancy, feel free to join my complimentary but private community, the Preggy Training Crew. The link is in my bio.